Namaste and good evening to all the participants. Welcome to the 34th episode of Easy Ayurveda Gurukula. So today we have with us Dr. Banashankari HL with us. We speaking on topic of Sheethapitta. It will be a case study. Hopefully we will all have a very good learning session with Dr. Banashankari. On behalf of all the participants and Easy Ayurveda, may I take the privilege of extending a cordial welcome to Dr. Banashankari to Easy Ayurveda Gurukula. Namaste, Dr. Banashankari. Welcome.
Namaste, sir. Thank you.
So, before Dr. Banashankari takes up with her presentation, may I introduce briefly the live platform. So, Dr. Banashankari HL is currently pursuing her post-graduation MD in Kaya Chikitsa, A.L.N. Rao Ayurveda Medical College, Koppa in Karnataka. So, has many achievements to her name. She is a good clinician, so good student, good orator, and also has precise knowledge of Ayurveda, so participates in healthy discussions, secured many prizes, and also has attended many national and international conferences, presented the papers, also is an active member in various fields of Ayurveda. So here we see that she secured first prize in the mobile photography contest organized by Department of Dravyaguna on the occasion of World Environment Day about the theme Only One Earth. So apart from that, a few paper presentations to name. So that Dr. Banashankari has presented at national seminar on topics of Agni and Amlapitta Chikitsa, at international seminar at Ahalya Ayurveda Medical College, Kerala, on scope of Ayurveda management on varicose vein. So apart from that, as I already mentioned, she has participated in many seminars and conferences, and currently doing her thesis. So the thesis topic in her MD studies is a randomized comparative clinical study to evaluate the efficacy of Katankateryadika Kwata and Vidanga Rajanyadikwata in the management of Madhumeha, with special reference to type 2 diabetes mellitus. Today, Dr. Banashankari will be presenting on the topic management of Sheethapitta through Shodhana and Shamana, a case study. So as I said, it will be a case study. Without wasting any time, I would like to hand over the badge to Dr. Banashankari. Dr. Banashankari, all yours.
Yes, thank you, sir. Namaste to all the respected members of Easy Ayurveda family and all the attendees of today's session. Today I am presenting a topic on the management of Sheethapitta through Shodhana and Shamana, a case study. Contents of the study: brief introduction to the Sheethapitta, Nidana Panchakas of Sheethapitta, general line of management, a single case study, discussion and conclusion. Sheethapitta is a skin condition influenced by environmental factors, our lifestyle, and hypersensitivity. So let's see more about it. Sheethapitta, the word, if we split into two, it is Sheetha and Pitta. Sheetha means cold, and Pitta, it can be referred as warm. So it is a condition caused due to dominance of cold, which is attributed by Vata and Kapha dosha or Pitta dosha. We correlate this with urticaria, which is red, itchy rash caused by vasodilation, increased blood flow, and increased vascular permeability. Now let's see what is Ayurveda stands out. If you look over the Nidana, there is no any specific mentioning of Nidana for Sheethapitta. But if we go through this Samprapti, we can understand that, or we can draw some conclusion about the Nidana. So that is why initially Samprapti is given, and from that we have to derive the Nidana. Samprapti goes like this: the pathogenesis of disease. Sheeta Maruta Samsparshat Pradushtav Kapha Marutav Pittena Sahasambhoyah Bahir Antar Visarpatah. Sheetha Pitta is caused by contact with a very cold breeze, that is Sheeta Maruta. This is vitiates with Kapha and Vata and increases them subsequently along with Pitta. This Pradushta Kapha Maruta Pittena Sahasambhoyah. The Kapha and Vata begins to travel externally in the skin and internally through the blood and other tissues. And we'll analyze it as Nidana Sevana causes both Vata and Kapha Dushti. Both Vata and Kapha are Sheeta Guna Pradhanata, where Vata is Ruksha, that is rough in nature, Kapha is Snigdha and Tuyas. When this combines with the Vushma Manda Guna of Pitta, which is already vitiated, and these travel together, that is Prasara, over the body through Tvak and Raktadi Dhatu, that is Tvak in skin and Raktadi Dhatu, blood and other tissues. Then they take Sthana Samshraya, that is settled or lodged over Tvak, that is skin, and Raktadi Dhatu, blood and other tissues, and causes skin manifestation. There is a Mandalotpatti, Shota and Mandalotpatti. There will be inflammation and rashes all over the body, resulting in Sheethapitta. Samprapti Ghataka, Dosha Tridoshaja, Dusha, Rasa and Rakta, Agnimanda, Shrotas, Rasavaha and Raktavaha, Shroto Dushti Prakhara, Vimarga Gamana, Udbhavasthana. Origin of this disease is Amashaya, and Vektasthana is Twak. There will be rashes over the skin level, and Swabhava, there will be Ashukari. It will be rapid onset of the condition. Nidhana, etiological factors of Sheethapitta. In Madhukosha commentary, Pitta, which is increased because of its own reasons, when comes in contact with cold breeze, causes the disease Sheethapitta. Hence, the Nidhana explained by Acharya for Sheethapitta is a Venjaka Hetu, that is triggering factor. So we can understand that Sheeta Maruta, that is cold breeze, is just a triggering factor. But there is some internal issue already existing which have a trigger that occurs of the skin condition. So we can understand that whatever causes Pitta Rakta Dushti, there is some already existing Pitta Rakta Dushti in the individual. And when that individual exposed to the triggering factor, that is cold breeze or some immediate change in temperature, they resulted in the manifestation of the condition. So we can derive that Nidhana, like dietary causes, Aharaja Nidhana, Viharaja Nidhana, that is recreational activities, Manasika, psychological factors, and other factors. So in Aharaja Nidhana, if we intake excessive Amla Lavana Katurasa, that is sour, salty, spicy foods, and Tikshna Guna food articles like Kulatta, it is horse gram, Masha, black gram, and Dadi, curd, etc. In Viharaja Nidhana, recreational activities, Sheeta Maruta, that is exposure to cold breeze, Ati Atapa Sevana, exposure to sun for a longer time, and Diva Sopna, day sleep. And Manasika Hetu is increase in Krodha, it is anger. Anya Hetu, Chardi Vega Dharana. We know that when the urge are being held or we suppress the Vega, it causes some symptoms. In Chardi Vega Dharana, that is suppression of the vomiting, causes one such symptom is manifestation of the skin diseases. Etadamsha, any insect bite, Vamana Ayoga, improper purification, that is emesis. And in Sharad Rutu, as Prabhava of Rutu, there will be Pitta Prakopa. Pitta will be aggravated in autumn season. Pura Rupa, premonitory symptoms. Pipasa Arachirillasa, Deha Angasada Gauravam, Rakta Lochanata Tesham, Pura Rupasya Lakshanam. This sloka is taken from Madhava Nidhana, 15th chapter. Pura Rupas are Pipasa, there will be excessive thirst, Aruchi, anorexia, tastelessness, Villasa, nausea, there will be oppression in the chest, Deha Sada, debility, Gaurava, heaviness in the body, and Rakta Lochanata, redness of eyes. Lakshana, Varati Damshta Samstanaha, Shotaha, Sanjayate Bahir, Sakanduttoda Bahulaschardi, Jwara Vidahavan. There will be Shotha, over swelling over the body, which resembles the Varati Damshta, that is wasp bite, like sting of wasp, which associated with severe Kandu. There will be a severe itching, that is Kandu Kafat, that is due to Kapha dosha. And there will be Toda due Todo Vatat, severe pain, Toda due to Vata dosha. There will be pricking sensation in the skin condition. These are the Bahya Lakshanas. There will be external symptoms. Symptoms appears externally. Chardi Jwara Vidahavan or Pittaja Lakshanas. There will be constitutional symptoms like Chardi, vomiting, Jwara, fever, and burning sensation, Vidaha, as a Abhyantara Lakshana. Coming to this Peksha Nidhana, there will be differential diagnosis. Differential diagnosis of Sheethapitta are Udarda and Kota. Before diagnosing as the disease Sheethapitta, we should know the similarities and dissimilarities of this condition too. Comes to Udarda, Udarda mititam vidyat Sheethapitta mathapare, Vatadikam Sheethapitta Udardastu Kafadikaha. In this condition has been identified as the disease, or these rashes are known as Udarda, and some other acharyas considered it as Sheethapitta. Whatever it be, we can understand that Vata predominance, Vatadikam Sheethapitta Udardastu Kafadikaha, where Vata predominant in Sheethapitta and Kapha predominant Udarda. And Lakshanas of Udardas are So Utsangescha Saragescha Kandumadvischa Mandalaihi Shaishiraha Kafajo Vyadi Udardaha iti kirtitaha. There will be Utsanga, there will be elevated rashes. Raga, reddish in color. Kandu, there will be severe itching. Mandala, there will be round patches. It aggravates during Shishira Rutu. It will aggravate in winter season. Another skin condition is Kotha. Asamyak Vamano Udirna Pitta Shleshma Anna Nigrahe. The features of Kota includes the following: incomplete emesis. When a patient is having asamyak Vamana, incomplete emesis, or samyak Vamana Lakshana not obtained in such condition, or the suppression of the Pitta, Shleshma, or Anna obstruction in movement of passing, these elements leads to rashes. Mandalani Sakanduni Ragavani Bahunicha. There will be appearance of innumerable rashes, red in color, and there will be severe itching. Kota aggravates in rainy season. This is quoted by Yoga Ratnakara. The same condition repeats, relapses again and again for many times. This condition called it as Utkotaha. Sapeksha Nidana, those are differential diagnosis. Sheethapitta is mentioned in Madhava Nidana as a Tridoshaja Vyadhi. Udarda, Acharya Charaka considered Udarda in Kafajananatpaja Vyadhi. It is also mentioned by Kashyapa and Vriddha Vagbhata. Kotha, Acharya Vagbhata categorized this condition in Raktaja Pradoshaja Vyadhi. Kota considered in Kshudra Roga by Sharangadara. Predominancy of the dosha. In Shita Pitta, there will be Vata Pradhana, and in Udarda, Kapha, and in Kotha, there will be Kapharakta Pradhanata. In Shita Pitta, Toda, the pricking type of pain, there will be Vataja Lakshana will be more, and in Udarda, there will be Kandu. Itching, Vamana, vomiting will be more, and in Kotha, there will be excessive Kandu. There will be excessive itching in this condition. In Shita Pitta, there will be Kinchit Mandalotpatti. The hives or rashes, we can call it as, there will be appreciable rashes will be there. And in Udarda, there will be Utsanga, elevated Mandalotpatti. There will be elevated rashes in Udarda condition. And in Kotha, there will be Raktaja Mandalotpatti. There will be blood like spots, rashes will be there in the Kotha condition. Etiological factors or triggering factors of Shita Pitta will be intake of Shita and Ushna Guna alongside. There will be aggravates in Sharad Rutu, it's in autumn season. And in Udarda, it aggravates in Shishira Rutu, that is winter season. In Kotha, when there is a Vamana Ayoga, improper elimination of dosha through oral route or a suppression of vomiting, and it aggravates or increases this condition in Varsha Rutu, in rainy season. It is Ashukari. Shita Pitta is Ashukari. There will be rapid onset of this condition. Udarda, it is a subacute condition. And Kotha is a chronic condition. If a Kota repeats or relapses again and again for many times, that condition is called as Utkota. Sadhya Sadhyata, prognosis of this disease, as Shita Pitta is a Bahya Roga Margashrita, a disease of external pathway, hence it can be considered as Sukha Sadhya Vyadhi, easily curable. Chikitsa. First line of treatment is Nidana Parivarjana. The first line of treatment for Shita Pitta or any other disease is Nidana Parivarjana, avoiding etiological factors. So it is advised to the patient to find out what may be the cause and try to avoid it as far as possible. We know that there is some triggering factors. We have to avoid that, and we should avoid things which causes the Rakta Pitta Dushti also. For example, exposing to cold breeze and having coke and spicy foods, it should be avoided. Nidana Parivarjana is most important thing. And in various classics, they explained Shodhana. Charaka says in Sutrasthana, Chikitsa Prabhrutiya Adhyaya, wherever there is a Pidaka, Kota, Kandu, the lesions, rashes or hives, and severe itching is there, to go for a Samshodhana. Purification therapy, Shamana, internal medicines, and Bahir Parimarjana, that is external therapies for Shita Pitta. Though there is no mentioning of treatment for Shita Pitta, in our Brihatra is one shloka from Chakradatta goes like this. Abhyangaha katutailena sekaha cha ushnambuvistataha udardaha vamanam karya patola arishtavarinah. We can do Abhyanga oil massage with katutaila or sarshapataila or mustard oil, seka with ushnambu, pouring of warm water as Svedana. After applying oil, that is Katutaila, we can do Seka with Ushnambu. In Udarda, we can do a Vamana with Patola and Nimba Kashaya. Vamana can be done with Patola and Nimba Kashaya. Udarda is a Kafadika condition, so we can go for Vamana with water boiled with Patola and Nimba Patra Kashaya for inducing Vamana. Another shloka is Kushtoktam cha kramam kuryat amla pittagna mevacha udardoktam kriyam chapi kota roge samasatah sarpishpitva mahatiktam karyam shonita mokshanam. Acharya also mentioned that one can take, we can adopt the Chikitsa Sutra of Kushta Chikitsa, Amla Pitta Chikitsa, Udarda Chikitsa, and Acharyas also mentioned that one can take Mahatiktaka Gruta followed by Rakta Mokshana. Up to this, we saw the what is Sheethapitta and etiological factors and the symptoms and prognosis and the differential diagnosis of this condition and the general line of treatment. Now we'll go with a case study. A patient, 27-year-old female, manufacturer in pharma company Bengaluru, complaints of reddish rashes, itching and burning sensation all over the body since 2 years, associated with a severe headache, chest burn, burning, micturition, constipation since 3 weeks. Initially, she neglected the complaints, but as the symptoms got aggravated, she approached an allopathic hospital and was on medication tablet Ocacit OD since 2 years. However, there was no significant relief and the symptoms were noticed frequently. No other comorbidities were noted, no medical or surgical history, and no relevant family history was there. Coming to her personal history, Aharaja, she used to take curd on a daily basis. She used to have spicy and sour items, very fond of pickles. She used to have tea more often and outside foods. And Vihara, she used to travel for the company and she used to expose her to the cold and wind. Vesana, she's a manufacturer in pharma company, and Manasika Nidanas, she had Chinta and Krodha. Then Ashta Vida Pariksha, she had Pitta Vata Janadi, she was constipated, she had a burning micturition and tongue was liptata, the tongue was coated, Jivha and Drik Shabda were intact. Sparsha, she had a local rise of temperature in her skin level. There is the her sparsha and ruksha, there will be rough nature in her skin. And Akriti was Madhyama. When you go through her personal history, as she is an employee in company, she used to go there on time, where there is in the traffic area exposed to cold and dust most of the time. She used to skip morning meals because to travel for her work. And she's a manufacturer in pharma company, so she was exposed to allergens, and she used to be seated in centralized AC room for a work about 8 hours a day. These are her triggering factors. After all her personal history, what we got are completely matched the Nidanas, etiological factors, which are already said by Acharyas, and those Nidanas we discussed in previous slides. After seeing her Ashtavida and Dashvida Pariksha, after examination, we can analyze that these are she's having Ama Lakshana. We found Ama Lakshanas in the patient. Local examination in the first figure, you can see these rashes, reddish in color, so maculopapular in nature, spreading on both hands and back. The rashes were irregular in shape, asymmetrical distribution. Lesions had irregular margin. There was no discharge and exudation. In second picture, you say hair over the lesions were present. Temperature rose over the lesions. The size varied from 1 centimeter to 7 centimeter. After seeing her etiological factors, clinical features, and on examination, we diagnosed it as Sheethapitta. We'll move on to Chikitsa. First comes Shodhana Chikitsa, purification therapies. We started with Amapachana. Our drug of choice was tablet Shardharana BD with warm water before food, because it is a Amapachaka, Deepaka and Bedaka and acts as a Vatanuloman. The observation noted in a patient, Prakruta Malamutra Visarjana, easily evacuation of stool and urine, and Sharira Laguta, lightness of the body, and Kshuda Pravruti, the increase in appetite. After getting Nirama Lakshana, we started with Sarvanga Abhyanga with Ishti Madhutaila, followed by Bashpa Sveda. Ishtimadu Taila because it pacifies Pitta Vata dosha and pacifies vitiated Rakta and releasing swelling, Shotha. Very next day, we gave Sadhya Vamana. There is a reference in classics that where there is a Vega Avastha in Utklishta Kapha, you can go for Sadhya Vamana. The Vegas were 8 bouts and there's Pittanta and we observed the symptoms like she had a lightness in her body and reduces in itching and reduced headache. These are the Pravara Shuddhi Lakshana we found in the patient after Sadhya Vamana. On the next day, we gave Snehapana with Mahatiktaka Gruta. Mahatiktaka Gruta because it is a Vata Pittahara, it is Tikta Pradhana and Rakta Prasadaka. In the Arohana Krama, in increasing order, we gave Snehapana after getting Samyak Snigdha Lakshana. In the days of 3 days of gap, in 3 days of gap, we gave Sarvanga Abhyanga followed by Bashpasveda with the same oil, that is HT Madhu Taila. And on the next day, we gave Virechana therapy, administration of oral medication to eliminate the doshas through anal route, wherein purgation is induced, drugs, and it specifically aims at the elimination of excessive pitta dosha from the body. We gave Trivrut Leha as a Virechana Aushadhi. We got Madhyama Shuddhi Lakshana, the Vegas were 20, and observations we were noted as she was a lightness and increased appetite. It was a Kafanta Lakshanas. These are the Madhyama Shuddhi Lakshana. Advice on discharge, these are the Shamanaushadhis we gave to the patient. Raktamrita Kvata 15 ml BD, capsule Puritin 1 BD, Avipatikara Churna 1 tablespoon BD with warm water before food. HT Madhu Taila as external application for 1 month. The patient was very happy with the response she got from Ayurvedic treatment in a short duration of time. Since 2 years, she opted for different types of conventional treatments for the same with no significant relief. It was affected her work and mood to the extent that she used to take a frequent leave from her workplace. The treatment helped in gaining confidence and improve her quality of life. As reported by the patient, she is asymptomatic since last 1.5 years subsequent to treatment and happy with the outcome. Patya Apatya, diet and regimen for all the skin condition, not only for Sheethapitta. Patya Ahara, food articles which we opted in this condition, those are Laghu Anna, light food, and Tikta Shaka, bitter vegetables like Kara Vellaka, that is bitter gourd, Patola, snake gourd, and Purana Dhanya, old cereals and grains, Mudgha, green gram, and Viharaja, Langanam Paramoshadhanam, one can go for fasting, and Abhyanga, body massage with Karanja Taila or neem oil or mustard oil. Apadya, that is food and behaviors which are not conducive or not wholesome to the body. And Aharaja, curd, that is the curd in different forms such as raita, lassi, dahi vada, mixed in curry, etc. Especially after heating should not be taken as kapha, there will be kapha pitta dushti and it's a abhishende guna and it causes rakta dushti also. Matsya, excessive intake of fish or irregular intake of fish or combination with the fish and milk should not be taken as it causes pitta dushti. Masha, that is black gram, urad dal can call it as, and its preparation such as idli, dosa, vada, etc. This causes kapha, pitta, rakta dushti also. Viharaja, we have to avoid chardi vega dharana, the taking of antiemetics. It causes it a habit of suppressing the vomiting. It will causes tridosha the dushti. And Shita Vayu Sevana, exposure to cold breeze increases kapha and vata. Diva Sopna, it should be avoided as sleep during the day vitiates the kapha dosha. Shoka and Krodha, anger or anxiety Varjana. Anger and anxiety vitiates Vata and Pitta dosha. They should be avoided always. Shamana Ushadis. When we explore the classics, we get many numbers of yogas and kalpas. Based on the necessity of the patient, ideal yogas can be selected and planned accordingly. These are some internal medicines can be used in clinical practice. Rasa Ushadis like Kamaduga Rasa, Suta Shekara Rasa, Chandrakala Rasa, Pravala Basma, Godanti Basma, in a tablet form, Arogyavardhini Vati, Namakarshika Guggulu, Kaishora Guggulu, Dushi Vishari Bilvadi Gutika, Churna, Triphala Churna, Panchashirisha Churna, Trikatu Churna, Yavanyadi Churna, Rajanyadi Churna, and Kwata form Amrutadi Yoga, Ishtadi Yoga, Patola Katurohinyadi Yoga, Manjishtadi Kashaya, Amrutottara Kashaya, Asava Arishta, you can go with Amrita Arishta, Manjishta Arishta, Grutas, Mahatiktaka Gruta, and Tiktaka Gruta. For external application, we can choose Karanja Taila, Nimba Taila, or Ishtimadu Taila, or Manjishtadi Taila, according to the condition of the patient. Conclusion, as Sheethapitta is mainly due to Kapha and Vata doshas aggravating and combining with Pitta doshas. So Vamana and Virechana pacify Kapha and Pitta dosha respectively. Hence in this study, Vamana Virechana karma have shown a significant results. Clinical features seen in this patient reduced drastically. As there is a reoccurrence of this disease, only Shamana Aushadhis cannot yield good results. Hence, by adopting both Shodhana and Shamana, the present case was successfully managed with complete remission without reoccurrence of the condition. Thank you.
Thank you. And that was the presentation, a case presentation on Sheethapitta and its Ayurveda approach through Shodhana and also the Shamana Chikitsa. So these are like challenging conditions in the medical practice because Sheethapitta is not easy to handle. So it always poses a challenge. So in one of the treatment principles, as Dr. Banshankari rightly mentioned, the treatment principles of Kushta and also Amlapitta can be considered in treatment of, I think it is from Chakradatta, so if I'm not wrong, that you have mentioned. So here when we see through the Madhava Nidana also, Sheethapitta, Udarda and Kota have been explained in a particular chapter. The previous chapter is Kushta and the following chapter is Amlapitta. So again the Acharyas tell in the Tika we can see in Sheethapitta or the Kota because of the Twak Dushti Samanya. So because there is a common factor Twak Dushti between Kushta and also Sheethapitta or the Kota. That is the reason it comes, the Sheethapitta or the Kota comes immediately after Kushta, the explanation. And also the Tridoshas are involved in Kushta as well as Tridoshas are involved in Sheethapitta Udarda Kota as well. And Amlapitta is explained as the next condition after Sheethapitta Udarda Kota. So because again of the dosha involvement of Pitta and Kapha being similar in both these conditions. So that is why I always keep telling, like the pre and the post context, even in Charaka Samhita or Madhava Nidana, whatever treatises we are reading, if we can logically analyze why a particular chapter has been like kept between two other chapters, so we may see not like a correlation between those chapters. A justification is given why this chapter comes after this chapter, and the approach of treatment also will be almost similar. So between those conditions, if not exactly. So the diseases are different, but the approaches will be like multidimensional. Here, Sheethapitta, Udarda and Kota has its own line of treatment. In spite of that, so we can administer the treatment of Kushta as well as Amlapitta. That gives a broad spectrum of the treatment options for Sheethapitta, Udarda and Kota. So this is one thing I just wanted to remark, as since the reference came from Dr. Banshankari about these three conditions to be handled in a single. So when we also see cases of Amlapitta, long-standing cases of Amlapitta, so few patients, if not many, suffer from Sheethapitta. So these two are always seen in like associated conditions. And a Vamana can be classical Vamana, or even in Sheethapitta Kota. In this particular case, you have given Satya Vamana. So a classical Vamana can be a very good remedy for Amlapitta associated with Sheethapitta as well. So coming to the presentation, so it was a very good presentation, I feel, covering all the aspects of the disease, right from the Nidana, the Pururupa, the Lakshanas, the differentiation between Sheethapitta, Udarda and Kota, and also mentioning of the Utkota, so which becomes a chronic condition there. So what is the treatment modality? So how different treatment approaches can be seen? So this is one condition which has not been explained as like there is no magnification of this disease in the classical treatises. So we find a short description, so like short treatment principles. Again, having said that, again we have the Kushta and Amlapitta treatment to come to the rescue of the patients of Sheethapitta, Udarda and Kota. So, and the case presentation was also interesting, Dr. Banshankari. So how was the treatment plan made? So how easy or difficult was it to convince the patient for Vamana? So because I find many doctors telling, so Vamana is a very good treatment therapy which is included in the Panchakarma therapy, but Many times there is a hesitation on the part of the physicians to plan up with the Vamana. So when we see that, how challenging it was, how easy or how difficult it was for you to convince the patient for the Vamana, and after Vamana, so what changes you people observed? So was it really evident enough? Or the immediately after Vamana, what was the response of the patient there?
There was no difficulty in taking treatment in patient condition. She was since 2 years she was taking with tablet Ocacet, that is cetirizine, in OD in every time when she got episode of Sheethapitta. So she want to get rid of it. So she came with Ayurvedic treatment. She was happy with the treatment also. We gave a Vamana. In after Sadhya Vamana, because we chose Sadhya Vamana because it was a short period of time we have. So that's why we chosen Sadhya Vamana. And there was no difficulty in she was getting treatment. And after Vamana, we noticed observations were noticed in her is there was no rashes, like there is burning sensation was gone, and she had increased appetite, and she has amla pitta lakshanas like chest burning sensation and sore belching. Those conditions were reduced after Vamana.
Okay, so that's really fantastic. I think so. It's always the skin is a sensitive issue. Health itself is a sensitive issue. When we come to skin is very sensitive. Be it a man or a woman, they would like to look really wonderful with in terms of their skin. So it also represents the health of the rasavasrutas, directly related to the hrudaya, so that is the heart and the circulation apparatus. So all these things are related to each other. The rasasara is explained in Ayurveda in terms of Tvaksara, so that is the richness of the skin, or the best quality skin has been explained. So which depicts the health of the rasa. Again, the rasa Mahasrotas has its mula in Hrudaya. So the Hrudaya is again a Manohasrotas as well. So psychology or the mind is also related with the Hrudaya to the skin and all those things. So what was the mental condition of the patient? We are speaking about Manas. Question number one to you, Dr. Banshankari. So what was the mind condition of the patient? And question number two, the sattva of the patient, how important it is in handling these conditions, whether it is kushta or amla pitta. So can you split this? How did you see this case through this?
She has manasika nidanas like krodha. She was depressed because she get oftenly the urticarial episodes. So she used to take leave from her company for every often. So she was anger also. So these are her manasika nidanas. And
yeah, so see, the manas is involved in this particular condition. How disturbed was she, and how important is the sattva of the patient to receive the treatment, and also after counseling. So the follow-up also, it is very important. So the mind of the patient and the mind status of the patient is equally important. So how do you look at it? So what were the tips you gave to the patient? Since krodha was found, krodha pittam, again it has an association, deep association with the pitta. So having seen that, during the phase of the treatment, she had some mental upsets. See, do we see that due to the mental upsets, the stress also can act as a flare-up for these conditions. They can act as triggers. And here, Krodha may be a factor associated with it's a natural way the patient has those mental behaviors. It's quite natural, it may be there. So that may also in due course of time trigger. So whether it is anger or anxiety or a depression or going into worries, having these conditions. So in spite of the nature of the person being like an angry or an anxious person, when these skin conditions like Sheethapitta or maybe Kushta like eclipse them, so they find it very difficult to cope up physically and also mentally. So it definitely goes to another tier of mental disturbances. And how important is for a physician to address this manasika component in the skin conditions. Speaking Kushta also.
So willpower is a most important thing for any disease, any gender. Speaking about for skin condition, willpower will be most important thing. Because it's causes cosmetic disfigurement. So
Yeah.
that's why willpower will be more important in every condition.
The willpower, so the courage factor, and also the volunteer to take the treatment, and also follow-up is very it needs a lot of discipline, isn't it, Dr. Banshikri? Like,
Yes.
so it's not all about, I keep telling that servicing is important and maintenance is also important, be it a vehicle, be it a human body, so, or a mind, so whatever we are treating. So service is important, equally important is the maintenance. If there is no maintenance, this keeps relapsing. So I have seen many conditions of Sheethapitta relapsing. This patient of yours has come during the stage of relapse, or was it a fresh manifestation? Did I miss any link there?
So that was not a fresh case, but since 2 years she had these conditions. One was she quit the job where she was in a pharma company. So that was a Nidana Parivarjana. That is, she was exposed to allergens. So, and she was in a centralized AC room about 8 hours a day. So Nidana Parivarjana is also a prime factor for chikitsa. So along with the Ayurvedic treatment, she got complete remission, sir. Up to till 1.5 years, she has no such conditions, reoccurrence of the episode of hives.
Okay, that's a wonderful report. So, like, it's always very interesting to see or hear from the patient that not only the symptoms have gone away, but they will be very anxiously waiting. So, will the disease knock at their door once again? So, will I get the symptoms back once again? So, this is where exactly the physician should plug in and keep telling and counseling the patient to have regular follow-ups, and also keep reporting if something happens and what precautions need to be taken. Especially the seasonal factor also is involved, and also the, as you said, the AC and other things. So the patient should gradually either learn how to keep away the things which are causing or also triggering that condition, or the doctor should educate them. So on a long term, the patient should, or the person who is taking the treatment or suffering from the condition, will or have to learn how to cope up with those conditions on a long term. So having said that, we'll take some questions from the question box. Diva Swapna is a Nidana. Can you please elaborate on the connection? Garunaji asked this question.
As Sheethapitta is a Tridoshaja Vadi, where Vata, Pitta, Kapha also involved in this condition, where in Diva Swapna there will be increase of Kapha dosha. So that's why longer term indulge in Diva Swapna, it causes Sheethapitta. Not only Diva Swapna, all the factors. When come to Diva Swapna, it causes Kapha aggravation. So as it is a Tridoshaja Vadi also, so yeah.
Yeah, so that's right. So since Diva Swapna is one of the kapha aggravating factors, so that can come into the play here. And so answering in continuation to Garunaji's question about the Diva Swapna, so here Nidana may be different for different people in whatever condition we are speaking, whatever disease we are speaking. The Nidanas will differ. So, but what is a Nidana we need to see. So, Nidana is that factor which has a capacity to produce an entire disease process. It has to produce an entire disease process. Here, Diva Swapna is one among the Nidanas. So, it may be a part of a collection of Nidanas. So, Nidana, Diva Swapna itself can cause, so like Sheethapitta, so we cannot tell that. So, it can be a trigger. So, it can be an aggravating factor. Many other conditions will be. So, that is why when explaining Nidanas, Ayurveda has mentioned a set of Nidanas. So here, more than one. So there will be multiple Nidanas playing their role. So at the physical and the mental level, Diva Swapna may be one among those Nidanas which is contributory. So we shouldn't miss out. That is why it has been mentioned in the list of Nidanas. So I think that gives a clarification. So continuing with Garunaji has like a set of questions here for you, Dr. Banshankari. As I understand, Rakta Mokshana mentioned as a therapy here can aggravate Vata. If so, can it even worsen Sheethapitta in some cases?
If Vataja symptoms are there, it will aggravate the cold.
Okay, so then I'll take up this question here. See, Rakta Mokshana, if it would aggravate Vata always, we would not at all use Rakta Mokshana as a therapy. That is why we have the Samyak, Hina and Ati Lakshanas here. So how we conduct the therapy. So the therapy has problems always when it is not done in a balanced way. Even in Vamana or Virechana, so when it is given inadequate way, so we have Hina Lakshanas, and also when it is given in a proper way, we have Samyak Lakshanas. When it is given in more dosage and many more factors are involved, so we have the Ati Lakshanas. I'm giving example. The same thing can happen. Ati Rakta Mokshana can lead to Vata Rakta. So, but judiciously, a physician, I feel, can judge what is the quantum of Rakta Pitta which is needed. and if at all, if it is a stage where Rakta Mokshana is needed in Sheethapitta or not. So that also need to be considered. So that is left to the choice of the physician when many other treatment modalities are there. So Rakta Mokshana may be considered as a Brahmastra or a lost tool or a particular condition where nothing is responding and probably Rakta Mokshana should be brought into the picture. Yeah. So coming to Garunaji's once again continued question, as you said, Pitta aggravating Rakta Dushti Ahara. Pitta aggravating Rakta Dushti Ahara is to be avoided. Fermented probiotic foods are sometimes encouraged for skin diseases. Even intake of apple cider vinegar, that also is inclusive. A number of people report good results. How to understand these cases in light of Ayurveda? So should I repeat this question? So as you said, Pitta aggravating Rakta Dushti Ahara is to be avoided. So fermented probiotic food are sometimes encouraged for skin diseases, even in intake of apple cider vinegar. Number of people report good results. How to understand these cases in light of Ayurveda?
In Pittaja Kaphaja condition, there will be no use. In Vataja condition, may use
This
for
one-
longer
The
duration.
question is about fermented probiotic foods as recommendations. So Garunaji, I think we don't prescribe these things like fermented probiotic foods. Your question is where in conditions where it is prescribed. So we will take it as upashaya and upashaya rather than chikitsa. So because it doesn't come in the principles of treatment of Ayurveda, so we will take it in this way. So like if something is relieving, so always the treatment principle goes as long as the treatment is not or any medicine is not causing any complications, any problems to the patient or the person who is taking those medicines, and also is providing results. So it is like a sone pe suhaga. So if it is really working, why not they can take? It doesn't mean that it should be suitable to everybody. So it can be an apatya for the other person as well. So that's why Ayurveda has a particular fixed protocol of a treatment of Sheethapitta. So here we are having a case study in this particular perspective. So so it's a good question. So probably a question for future interactions in yet another session. So I think, so logically I have answered this because this is a case presentation and also we have particular treatments taken into consideration. And coming to Ayurveda, so I don't see Ayurveda doctors prescribing apple cider vinegar or fermented probiotic foods. So maybe a few. So I don't think if classical practitioners of Ayurveda will only take up for these conditions and treat them in the Ayurvedic methodologies, though it's a very interesting question. Going to the next question, Jay Raghuji's question, good presentation. Will Basti be considered in any case since Vata is involved? I don't think so because see, Basti or Basti, we call it as it's a broad spectrum treatment. So given for many conditions in Ayurveda. So, but here we need to see again, since Vata is involved, it is a Tridosha condition, no doubt about that, Sheethapitta, Udarta and Pota. But we have the treatment principles basically belonging to where it inclusive of Vamana and Virechana in this condition. So Basti has not been classically mentioned or elaborated. As I said, this is a short condition. And then going through the Kushta also, when we are treating to the Kushta and also Amla Pitta, these are the conditions where we don't administer plenty of, like Basti is not brought into the play. All these conditions will strictly require Virechana and Vamana as main line of therapies. Maybe in Kushta also we have Rakta Mokshana. So here also it can be strategically brought, but not as a main line of treatment. So in Kushta and Vata again, yes, Rakta Mokshana will be brought into the picture as the main line of treatment along with Vamana and Virechana. Vasti is preferred to, if at all, if we take Vasti into consideration in Kushta and also Sheethapitta, Udarta and Pota, it will be like at the end of the treatment as Brahmastra to see that the conditions don't relapse. So when we are considering Vasti, we should see that the patient is totally asymptomatic. So totally asymptomatic. It can be given as a preventive measure. Here, Vasti can be given as a preventive measure. We know that there are so many Vastis which are given for not only Vata but also Pitta and Kapha conditions. But here, Vasti, which is preventive in nature, so Vasti has a big role to play in overall health, not only as a curative but also as a preventive therapy. So from that particular perspective, Vasti can be given, not mentioned in the line of treatment, so strictly we will consider not to be considered. So, but again, yukti is one thing. So that is the rational thinking of, and also the judgment of the physician and proper planning of the treatment protocol and the blueprints. That's what we take into the question. So if the physician feels, okay, the patient is asymptomatic, not having any rashes for a couple of years, like 2.5, 3 years. So let me go with some vasti, so that the patient keeps up the health. So even if there are occasional symptoms, at a particular point when you judge whether Vasti should be given or not, the person shall be asymptomatic and you can go. We have Varne Vastis like which enhance the color and the complexion of the individual. So we also have Vastis which can be very much preventive of the skin disorders, all those things, and also the Pitta specific Vastis, Kapha specific Vastis. So depending on the decision of the physician, may not be as the main instrument of treatment during the active phase of the treatment. It can definitely be considered in the later part, but not as mentioned in the, so I don't see it mentioned in the treatment protocol. Many people genuinely follow the Chikitsa Sutra, so like the classical treatment principles which have been given. So some people go to the level of experimenting. So the experimentation can result into a very good result, so, or it may not be that. So you need a lot of courage to go against the principles of Ayurveda and practice something. So if it is needed, so we'll bring it into the picture. So I think that answers the question. So though it was an important question as well. Kalpana ji asks, what is 8 bouts of Vamana? Is it only one Vamana therapy and 8 bouts, or is it 8 Vamana therapies for 8 days? No, Kalpana
No.
ji. So it is. It was Sadhya Vamana, right? So it was Sadhya Vamana. Even we cannot even give Vamana for, Vamana is given on a single day, whether it is a Sadhya Vamana or a Krama Vamana. So after Snehana, Svedana, the Vamana comes, it is given on a single day. So Kalpanaji, so it is not, your first question is correct, first part of the question. Is it only one Vamana therapy and 8 vows? Absolutely yes. And it is not the other way, 8 Vamana therapy, 8 days. So here it needs an understanding of Vamana. So like it is also calculated as there are different ways of analyzing whether the treatment has gone in a correct way as we required it to go or not. So depending on that, we have many types of Shuddhi. So here this is called as Vaigiki Shuddhi. So where the Vegas are counted. How Vegas means bouts. How many times the person has vomited, how many times the patient has purgated. So even in Vamana and Virechana, we take these Vaigiki. So generally we take it as Lakshanika. So like the symptoms of Samyak Vanta and also the Samyak Virikta. So like proper emesis and proper purgation, we take those symptoms strictly. So the other ways is this one. So like Vaigiki Shuddhi, so the Vegas we count and consider, and also so write down on the case sheet that this person has had a proper vomiting, inadequate vomiting, excessive vomiting. So that helps us to know what exactly we need to do ahead. And then comes the Maniki Shuddhi, so where the quantity of the vomiters and also the quantity of the defecation which happens in Virechana, so those things are also calculated. So these are the different types of Shuddhi. So that's an important question. So yes, it is the one Vamana and 8 bouts. After 8 bouts, also Banshankari, was the patient tired enough, or was the patient okay after taking the Vamana?
Was tired, sir, but she was okay with the treatment also.
So have you, so like, did you bring the patient into confidence that Vamana, after Vamana therapy, you will feel a little bit of tiredness and that's quite okay?
Yes, sir. Yes, sir.
So here we need to see is in Vamana and Virechana, though there are multiple vomitings and in Virechana multiple purgations, but they will not cause the same effect of a pathological vomiting and a pathological diarrhea or dysentery. No. So because here the doshas are going out of the body, so the patient will feel a mild to moderate weakness, but that will come down. That is why we have the Samsarjana Krama or the dietetic protocol after Vamana or Virechana. So coming to Swapnaji's comments, Namaste, thanks for wonderful presentation. Can Sheethapitta Lakshanas appear only on few areas in the body? This is a general question, Dr. Banshankari. Can it appear on, should it be a full body presentation or only on few places of the body, like only limbs, only trunk, so like that?
No, sir. The rashes can be present
No,
all over the body.
Not in the case which you have handled. So it's a general, like in a general Sheethapitta condition.
In general, all over the body. can manifest.
Okay, so generally it is manifested all over the body. So it can be partial. So I have seen some Sheethapitta cases where there are
Swollen.
Sheethapitta rashes. Yeah, so in particular areas of the body. Ujjwala ji asked the questions. Please explain details about Sadhya Vamana, Drava Dravya. Sadhya Vamana is a process where the Vamana is conducted instantly. So like without much pre-preparations like Snehana and Svedana, which is done for a Krama Vamana. So Dr. Shivaleela ji, thank you. It was nice presentation. Even though Pitta is prime dosha in Sheethapitta, why it is aggravated when exposed to cold and in winter?
This is a Shita and Pitta. Shita here's Vata and Kapha. There will be Shita Guna. Shita Guna will be there in Vata and in Kapha dosha. So it's the Tridosha Javadi. So there will be Shita Marja Sansparsha. There will be exposure to cold. There will be increase of these conditions.
Absolutely. I think that answers the question, Dr. Shivaleela ji. Thanks for that question. So because here we see the Taratama Bhava. So we have Vata, we have Kapha, which are more aggravated in comparison to Pitta. So here, rather than telling that Pitta is a prime dosha and what is the question? Why it is aggravated when exposed to cold and in winter? No. So it is always the Vata and Kapha which gets aggravated and the Pitta is brought into the mask. So the Pitta will be subsided to that particular level. So though it is involved, but there is a masking of Pitta by Vata and Kapha. So that is why the word Shita has been used with Pitta, just like Amla has been used with Pitta to denote that there is a change of taste. So here to denote that there is a change of behavior. So when the heat things come along with cold things, there is a masking of the heat things, like Pitta is masked by the properties of Vata and Kapha. As Dr. Banshankari said, it is a Tridosha Vadi, just like Kushta. That's why it's explained after that particular context. So the behavior of the Pitta will be like Vata and Kapha itself, because it has been masked here. So, though it is a Tridosha Vyadi, again seeing Taratama Bhava as in Sannipata Jujora, we can take slight predominance of Vata and Kapha in this condition.
Namaste, sir.
Namaste,
Ma'am.
Gururaja.
So, my question was, this case, what was the dravya used for Sadhya Vamana? It was salt, Sandhav Jala or Yashti Madhu Jala?
Both, sir, both.
Both were used?
Yes, sir.
Vasanta Reddy, madam. Okay, when the allergy conditions are considered, do you base it on sensitivity tests or based on talking to the patient? Very, very important question. Dr. Banshankari,
Yes, sir.
is it important to go with sensitivity tests and then decide in these conditions? Is it only one-to-one, like you speak to the patient and take the history and then decide the treatment protocol, or a mix of both? How would you consider? Keep it short.
First, we'll ask a history with the background of three doshas. So we'll go with the treatments. Sometimes, if there is a systemic elements also, we'll go with all the tests.
Absolutely. Vasanta Reddy, madam. So if in doubt, Ayurveda has its parameters of diagnosis, so like many parameters. On that, if we can diagnose the disease as Sheethapitta, well and good. So we come to a conclusive diagnosis as it is Sheethapitta or Udarda or Kushta, variant of Kushta, whatever it is there, and treat accordingly. If in doubt, so we can also refer the patient. So that's a good suggestion to the sensitivity test. So in spite of having made a diagnosis, there is no harm in sending the patient for a sensitivity test. So that will double confirm things, and also it may add to the treatment strategies or the treatment protocol. So where small variations in the treatment protocol, we can do it on the basis of the sensitivity test. Thanks for that recommendation. Thank you. So Dr. Shivaleela, madam, again asks, can we know about Vamaka Dravya used for Sadhya Vamana and its dosage in this case?
Yashti Madhu Fanta, Kantapana, Dugdha, and Lavanodakas we used, sir.
Okay, so thank you there. So I think, I guess we have come to the end of the session. I would like to extend a heartfelt thanks to Dr. Banshankari. Thank you, Dr. Banshankari. A big thanks, namaste, and loads of love from Easy Ayurveda. Namaste.